A lengthy 2-decade study in the 1980s concluded that the greatest indicator of life expectancy was neither genetics, nor the amount of daily physical exercise, nor even diet. It was lung capacity. This study revealed that as the lungs became smaller or less functional, subjects became ill and died more frequently. This indicates us that larger lungs equal to a longer and healthier life. According to researchers, taking full inhalations is a measure of life potential. In the year 2000, scientists from the University of Buffalo conducted similar studies with the same results. But what these studies don't tell us is the capacity humans have to manage and modify our internal organs like the lungs, even at an advanced age. Those who practice free diving know this better than anyone. Most of these athletes manage to significantly increase their lung capacity by an astonishing 30 to 40%, even possessing lung capacity more than twice the average. None of these free divers had this capacity inherently, they expanded their lungs through sheer willpower. Fortunately, one doesn't need to dive to dozens of meters deep. Any practice that can help expand and flexibilize the lungs can increase lung capacity. Moderate physical exercise can increase lung size by 15%. And while breathing is a reflex action, meaning our body does it automatically, it's not just a physical or biochemical act. It's more than just moving the diaphragm and inhaling air to feed our hungry cells and eliminate waste. The tens of thousands and millions of molecules that enter our body with each inhalation also play a more subtle yet equally important role. They influence almost all our internal organs, signaling when to turn on and off, affecting heart rate, digestion, mood, attitudes, determining when we're excited and when we're dizzy. But if this is the case, why do we need to learn to breathe correctly? Well, the quality of our breath significantly influences our health, and what has been observed is that our current way of breathing is deteriorating our health. So why haven't we been taught something so fundamental from a young age? Follow me through the whole video till the end, where I will show you the dangers of mouth breathing and its consequences, and how we can help our children. Currently, 40% of the population suffers from chronic nasal obstruction, and half of us breathe through the mouth, with children being the most affected. There are many causes, whether due to dry air, stress, allergies, inflammation, pollution, or even medications. However, a significant part of the blame can be attributed to our continually growing cranial structure. When the mouth doesn't grow wide enough, it causes the upper structure to narrow, the palate takes on a vaulted shape, and this narrow palate prevents the development of internal nasal structures, creating an obstruction and making breathing difficult. This nasal obstruction causes a narrowing of the upper airways and prevents us from breathing through the nose, forcing us to breathe through the mouth. But why is mouth breathing dangerous? Mouth breathing leads to a series of physiological changes, all for the worse. When we inhale through the mouth, it's usually in short, fragmented actions. Inhaling air through the mouth reduces the pressure of the soft tissues at the back of the mouth, causing them to become loose and flex inward, a process that reduces space and makes breathing more difficult. Mouth breathing essentially generates more mouth breathing. Mouth breathing activates catecholamines and stress hormones, indicating that our bodies are under physical and mental constraint. When nasal congestion appears, air circulation decreases, mucous membranes become congested, inflamed, and cilia are paralyzed. As a result, viruses and bacteria in the mucosa become active, reproduce, and can lead to infections. This can lead to colds, sinusitis, and generate more congestion. Congestion begets congestion, and that further forces us to breathe through the mouth. Additionally, when seasonal allergies occur, cases of sleep apnea and respiratory difficulties skyrocket. The nose becomes congested, we start breathing through the mouth, and the airways collapse. When we breathe through the mouth, the unfiltered air that enters is cold, dry, and lacks humidity. This causes our body to become dehydrated and lose 40% more water. Blood pressure rises, and heart rate variability plummets. Breathing through the mouth leads to lower oxygen levels, and when these levels drop below 90%, the blood cannot transport enough oxygen to bodily tissues. If this persists, it can lead to heart failure, depression, memory problems, and even premature death. Sleeping with the mouth open at night allows unfiltered and unpressurized air to enter our mouth, collapsing the soft tissues of our throat. This leads to near constant suffocation in most cases. 45% of the population occasionally snores, and a quarter of the population snores chronically. Sleeping with the mouth open causes these problems. When we lay our head on a pillow, gravity pushes down on the soft tissues at the back of the throat, further obstructing the airway. Over time, our airways become conditioned to this closed-off position, making snoring and experiencing apnea something normal. These issues can lead to various disorders, including insomnia, morning headaches, night insomnia, hypertension, nocturnal enuresis, attention deficits, and many more. When it comes to children, 90% of them have currently developed some degree of deformity in the mouth and nose. Recent research discovered that children who breathe heavily, snore lightly, or exert extended respiratory effort may suffer from physiological, emotional, and even learning disorders. Mouth breathing contributes to bad breath and gum disease and can cause cavities, this being even more damaging than sugar consumption, poor diet, or inadequate hygiene. Perhaps most surprisingly, mouth breathing makes us dumber. Yes, you heard that right, dumber. Recent studies in Japan found that mouth breathing led to decreased oxygen in the prefrontal cortex. These studies concluded that it leads to fewer brain cells being developed, thus diminishing our intellectual capacity to solve problems. All this narrowing of the palate, this nasal obstruction that forces us to breathe through the mouth, this constant mouth breathing, leads to a series of facial modifications. This results in flattening of the cheekbones, creating a less attractive facial structure. Anthropological research and biographical accounts of intrepid travelers who journeyed through North America encountered different Native American tribes, differing in traditions, customs, and with different diets, but they all shared a similar constitution: tall, wide backs, muscular chests, with squared, symmetrical and proportioned faces. Having never seen a doctor or dentist, all of them had perfectly straight teeth. According to the accounts, none of them seemed to fall ill, and chronic health problems or deformities were rare or non-existent. These tribes attributed their robust health to a medicine they referred to as the secret of life, breathing. The mothers of these tribes followed the same practices. When they ate, they closed their mouths after each bite, and when they slept, they kept their mouths closed. If they saw an open mouth, they even adjusted their positions to keep them from opening. All these day-to-day habits built a consistent pattern of behavior. We've observed similar practices in other tribes, such as those in the Andes of Brazil and other parts of the world. With each breath, billions and billions of molecules pass through our nose. The nose is critical for collecting pathogens. It filters, humidifies, and warms the air. Mucus is our body's first line of defense, sweeping at an approximate rate of 13 centimeters per minute, around 18 meters per day. All these pathogens could cause infections if they entered the lungs, which is more likely when we breathe through the mouth. The nose collects inhaled debris, then transports it to the throat and stomach, where it is neutralized by stomach acids and eliminated through the digestive tract. In addition to filtering, the nose slows down and pressurizes the air so that the lungs can extract more oxygen with each breath. Lastly, it warms and humidifies the air so that it reaches our body temperature and is easier to absorb. Nasal cavities function as climate control systems, regulating temperature and blood pressure and emitting substances that can affect emotions, mood, and sleep. Inhaling through the nose forces air to press against the soft tissues at the back of the throat, widening the airways and facilitating breathing. Over time, these tissues and muscles tone themselves to remain in this open and wide position. No matter what happens to the nose, it affects what's happening in the mouth, airways, and lungs. One of the many benefits of nasal breathing is that the sinuses release a large amount of nitric oxide, increasing this molecule by a factor of 6, allowing us to utilize 18% more of the oxygen we breathe. Nitric oxide plays a crucial role in boosting circulation and supplying oxygen to cells, immune function, weight, circulation, and mood. In addition to sexual function, they can influence significantly by the amount of nitric oxide in our body. Nasal breathing is also relevant in the context of erectile dysfunction. Furthermore, nasal breathing triggers a cascade of hormones and chemicals that lower blood pressure and aid digestion. But breathing through the nose isn't enough if we don't do it correctly. Nasal breathing, unlike mouth breathing, is slower and less frequent. Increasing the time between breaths and elongating exhalations means that carbon dioxide levels rise. With increased carbon dioxide, in addition to gaining greater aerobic endurance, maximum oxygen volume increases, not only enhancing athletic endurance but also contributing to a healthier and longer life. In summary, the air inhaled through the nose keeps the body strong, beautifies the face, and guards against many diseases. For all these reasons, air inhaled through the nose is much more efficient and healthier than through the mouth. One could say that the nose is a warrior and guardian of our body, the pharmacist of our mind, and the guide to our emotions. If you enjoyed the video, please hit the like button, subscribe, and activate the notification bell.